Hello. I'm going to put you in a situation. Just imagine that you go to the eye doctor because your vision has seemed to have gotten really bad really fast. After looking at scans of your eyes and doing an eye exam, vision screening, the doctors seem to line up to take a look at it. Then they have you go to the neurology department the next day for an MRI. They just want to rule out a brain tumor. Are you freaking yet? After the MRI, they have a line of med students all lined up wanting to get a good look at it. It's rare, it's something they've never seen before. And then they let one of the med students perform a lumbar puncture, his first one ever. Since the patient is very uncomfortable, confused, and scared about knowing what's going on. So after all the tests were done and they can't find anything that they were looking for, they come up with a diagnosis of idiopathic intercranial hypertension, also known as pseudotumor cerebri. Basically, this patient is losing their vision because they have too much spinal fluid that is putting pressure and damaging their optic nerve. And the doctors say that this condition is because of the patient's obesity. So the patient found out that they're losing their vision because they're fat. This was a tough day for that patient. The pseudotumor cerebri is very rare. It's mostly found in women of childbearing age who had a recent weight gain. Some of the symptoms involve severe headaches, transient visual obstructions, which basically you just have just a bit of blindness come across one side, lasts about 30 seconds, and then it goes away. Some complain of a whooshing noise in their ear. There's also pain behind the eye or pain with the eye movement. Some complain of double vision, and some just have some total vision loss. This is diagnosed after viewing images of the eye, checking for swelling of the optic nerve. There's also a lumbar puncture they're going to rule out any type of infection in the spinal fluid, and they're going to basically check the pressure of the spinal fluid. And then they'll do a MRI or a CT scan just to look for abnormalities in the brain. So after all these are ruled out, then they make the diagnosis. Basically, there's nothing else that it can be, so this is what we're going to call it. There are several different courses of treatment for this condition. Usually they try to encourage the patient to start with a weight loss. 5 to 10% weight loss, 5 to 10% of your body weight loss would, they said, should correct the problem. If not, then they'll move on to a form of diuretic. And the most common diuretic has some serious side effects that the patient should be aware of, such as a tingling in the fingers and toes. That's just a sign that the medicine is working and doing what it's supposed to, as well as numbness in the lips, tongues, and nose. It's very similar to the early starts of a good buzz without the alcohol. So these are side effects that the patient really needs to know about. There's also a surgery that can be performed if all else fails, and that would be to place a shunt in the spinal column, allowing the spinal fluid to drain from the spinal column into the abdominal cavity. And which is they say it's a routine procedure. For me, it seems a little invasive, but we're going to try with the weight loss and the medication first. This was a very interesting topic for me to speak about because it's a serious issue that's considered rare, but I'm meeting more and more people with this condition, so I'm not sure exactly how rare it is. And they said the research that I've done says that most vision loss only occurs when the patient doesn't follow up with appointments. And after 2 years from seeing the doctor, I finally go back, and my left eye is irreversible at this point, and my right eye, we're struggling to maintain it. So I am the patient that I spoke of at the beginning of this speech, and it's a scary thought that I'm putting all this effort into school and I might not actually be able to work as a nurse once I'm done. But I'm doing this research because there's so many conditions out there that we always think that school or work has to come first, and we really have to take the time to take care of ourselves first. And this is one of those conditions that I really need to stop, take care of myself first, and then worry about school. But intercranial hypertension can cause blindness as well as headaches and whooshing, and can really disrupt your world. So if you know anyone with these conditions, remind them that it's important to follow up with the appointments. Thank you. Oh, that ended